Back everyone, TV5 News at 9. We're talking about getting on a roadmap to better health. So joining us this morning, we have Angela Williams, who is the Senior Vice President of Great Lakes Bay Health Center. Angela, always a pleasure to have you. How are you?
Thank you. I'm good. Good to see you today.
Good to see you as well.
On a snowy morning.
I know, right? You gotta love the weather.
Yeah.
So during COVID, post-COVID, many kids, we know, missed their appointments and routine vaccinations. So why is it so important for these kids to get back on track?
Well, according to Centers for Disease Control, which is CDC, it's important that we ensure that children have a better chance of getting healthy by taking their recommended vaccines. And some alarming statistics that I found before this interview were related to the CDC estimating that vaccination of children born between 1994 and 2021 will prevent 472 million illnesses for children and adolescents and avoid over 1 million deaths, which is very concerning.
Yeah, when you showed me that, I was just like, 1 million. And this is just kids we're talking about.
We're just talking children, 0 to 18 years old is what we're talking about.
So for vaccinations, let's run through maybe some age groups of what vaccinations would be good. So for kids under 2.
Well, we have posted, hopefully, the schedule I'm sharing today for vaccinations from 0 to 7, and then 8 to 18. People need to be aware as parents of what that schedule looks like, because there's numerous vaccinations or vaccines that parents need to be diligent in terms of, especially babies receiving. And one concern for children 2 and under is their systems are prone to being exposed to more germs. In addition to that, the food they eat, the air that we breathe, and what they touch on a regular basis. And so with that happening, we want to make sure that our children, our babies, receive those vaccines in a timely manner. And it is hard to see babies getting X amount of shots at an early age, but we want to protect and improve their immune systems for especially preventable diseases and complications, seriousness of health illnesses that could lead to death.
Yeah. And I think that's always great to remember too. So for parents, it could be that difficult decision you said, seeing, you know, a kid getting a bunch of vaccines at once is could be alarming for some. How does someone address those concerns, or how does Great Lakes Bay Health Centers address that?
Well, it's important that our parents, and I always stress this no matter when I come on here, is it's important for our parents and their families to become educated. Before seeing the doctor for that well child visit, which is very, very important that babies, children, and adolescents get an annual physical or well child visit. Before you take your child to that visit, write down any concerns with the doctor. Write down anything that you've noticed different in the baby, especially behavior, even your teens. If you're noticing something that's atypical, that's what should be discussed with the healthcare provider. And I know there is so much misinformation out there in the public about vaccines, and so those are decisions that have to be made with your credible healthcare provider. Don't rely on social media, because sometimes the information can misinform you in the wrong direction. And so if you want to go to credible websites, go to Centers for Disease Control.
Very good. For our teens, what kind of vaccines should they be looking at?
We want to stress the importance of teens catching up on those vaccines too, because many of our teens right now are really behind. At the same time, we stress that they should get their flu shots. Something that's really important, especially if teenagers or graduates are considering college, is to complete their meningitis vaccine or meningococcal vaccine. So that is really important to keep them safe as they attend college. Yeah,
and even though I will add too, personally, you know, being away from home, it was hard to get those checkups. So I always had to do it before, just to make sure my bases were covered.
And we try to stress that, especially at our school-based health centers, we have all of these vaccines readily available. And usually, college applications will require that you receive that vaccination, but again, there is vaccine hesitancy, and so it's important to get the credible information.
Yeah, absolutely.
Yep.
Speaking of credible information, is it too late in the season to get the flu shot?
It is not too late to receive your flu shot.
Good.
Children, adolescents, and adults. Flu shots are still readily available. COVID vaccine is still available, and we urge the public to get vaccinated.
So, Angela, CDC produces a new approach to educating the public about these preventable diseases. I also would like to highlight that keyword, preventable. What is it?
Well, they have a new initiative, and the priorities are related to protecting our communities, meaning that we want to improve the vaccination rates on a state level, on a local level, and on a county level. And so the education and making those vaccines readily available is one of the goals of CDC. In addition to that, as I said earlier, informing and empowering families. Get informed.
Yeah.
If you don't understand something, ask. If you don't ask, you won't know.
Right.
And so you can say, oh, that shot might kill me. No. Ask your healthcare provider, whether you attend Great Lakes or whoever your healthcare provider, please take that opportunity to get informed. And then the other goal of CDC is to stop the myths in terms of misinformation, because that is like a huge boulder right now that we have to dispel those myths. So,
anything else you want us to know, Angela?
well, again, vaccinations are readily available at Great Lakes Bay Health Centers. We take every insurance. Everyone is welcome. New patients, if you are uninsured, we can help you with that. But our goal is to prevent vaccine preventable diseases, complications, and death. So go to our website. We have an app that's available through CDC for you putting in your baby's date of birth.
Okay.
And it will tell you right away what
vaccines?
they need.
Oh,
yeah.
No way.
So that is on our website, and it'll be shared on your website too. So
That's
thanks.
right. Yes, very good. Thank you,
to see you.
Angela. Good to see you too.
Thanks.
And like she said, you can find the information by going to the hot links section that is on our website at WNEM.com.